Hello.
Hi, Tara. We're ready
Hi,
to start.
Tara.
Hi, sorry, I was just in the middle of another workshop, so my apologies for being late.
Not a problem. We have our attendees who have joined, so I think we're ready to start. If you are, I will advance the slides, and the floor is yours.
Thank you so much, and welcome everyone. It's so great to see everyone here today. Before we begin, I would like to welcome you to the University of Calgary and take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nation. The city of Calgary is also home to Métis Nation of Alberta Region 3. Okay, so welcome everyone, and thank you so much for the OIPH and their education leadership for putting on this symposium or this webinar for us. This is largely focused on the CIHR Health System Impact Fellowship Program and Competition. And by the end of this seminar, you will be able to learn more about the competition and the program, as well as learn about the supports and resources that are available to you as applicants, either through the Cummings School of Medicine or through the O'Brien Institute for Public Health. Can I have the next slide? So very briefly, we are just going to do a quick overview of the panel, and then I'm going to turn it over to the panel for their input. And then there's going to be time at the end for me to moderate questions and answers. I would ask everyone to please mute their microphones just so our speakers aren't distracted with background noise. And please put your questions in the chat, and I will be monitoring the chat function during the course of this webinar. And depending on how it goes, where appropriate, maybe I will ask the moderators at the end of their section to address questions, and we'll just make sure that I keep track so each of the individual moderators can have a chance to chat or a chance to speak. So I'm so pleased to welcome each of our moderators. Our first speaker is Dr. Deborah Marshall. And Dr. Marshall is the Arthur J. Eachell Chair in Rheumatology Outcomes, and she's a former Canada Research Chair. She held a CRC position for 10 years. Her research program focuses on assessing the value of healthcare interventions through measurement of patient preferences, cost-effectiveness analysis, and simulation modeling. And she leads the health economic patient preferences and patient engagement activities at several national, international research programs and medicines. And I've had the pleasure of getting to know Dr. Marshall a little bit better over the past couple of years. And she is, quite frankly, just a wealth of knowledge and an absolute resource for all things health economics, a fantastic mentor, a fantastic supervisor, and really, really pleased to turn it over to Dr. Marshall for the first part of the session.
My goodness. Well, thank you, Tara, for that very nice introduction. And thanks everybody for being here, and thanks for your interest in this program. I really believe this is an exciting opportunity, so I'm glad so many of you are interested, and we want to make sure we have a strong group of people coming in from University of Calgary to this competition. I'm also really pleased to serve as the academic liaison for this program because I like it so much. So I hope some of you were able to attend the December 3rd webinar that CIHR put on. Some of these slides are directly from that webinar, but there are a lot more slides, and we can circulate them to you afterwards if you're interested to receive them and weren't able to attend, because it has a lot more detail than we can go into in this session. Our focus today is really to try to give you some contacts, support, and also talk about the details with respect to getting your partner, and get some good advice from former fellows on how to go about doing that. So that's where we're focusing. But this webinar by CIHR has a huge amount of really good information, and this is the agenda from that webinar. So you'll see it covers all the nitty-gritty details. So please go to that website. Next slide, please. So just as a very high level, these are some of the key messages that were presented in that webinar. I will only highlight two. One, start engaging your partner now if you haven't already. Really important. It takes time to find your health system partner, get a good match, and focus in on a relevant question to both of you. So you need to do that, well, yesterday, really, if you don't already have someone, in order to have a good competitive application by February 18th. The other thing is they're offering 66 fellowships. So there's quite a great opportunity here to win one. So you have a good chance if you have a good application. The third little point on here that I wanted to highlight is that if you already submitted in the previous competition and then it was suspended, you still have to resubmit. So don't just assume because you submitted it that it's sitting in the system. Even if you don't change anything, you still have to resubmit it. So don't miss that. Next slide, please. Why would you want to do this? So for those of you who don't know much about it, I think what's most exciting, and I'm not going through all these details, they're in the slides, you can read them, but it's the opportunity, I think, to partner with the health system partner and affect change and sort of be on the front lines of how do you deliver, how do you take research and put it into action. And so I think it really gives you a real live, KT experience. It gives you exposure to other perspectives than academics. I know all of you have wonderful supervisors, but academic supervisors mostly bring a perspective of academia because that's what they do. So it's really great to get this alternative perspective on things. Next slide, please. The Health System Impact Fellowship was created in the last few years by CIHR, and I really espouse this program. It's relatively new, but the focus is really on impact. And you'll see in these bullet points, this is their solution to try to create impact-oriented career paths, expand and broaden the traditional training environment for our graduate students, and also increase the organization's awareness of PhD trained organizations. So I think the thing here is that you get huge opportunities for relationship building and also networking. They have an incredibly rich training program that's on top of it. I will also highlight it's a lot of work. It's not like just winning a scholarship for a fellowship. You are expected to contribute, but I think you get a lot out of it and a lot of skill sets that are very broad that you might not otherwise get in your routine training. Next slide, please. The other thing is that the funding is special. So it is a partnership, and in particular, not only is the time split, the funding is split. So this is part of the reason why you need to really make sure you have a committed partner and the right partner for you, because you need also to get a commitment, a financial commitment from that partner organization. So this is very important, and read the fine print on this when you're doing your application for your letters. Next slide, please. So I'll just give you a couple of my top level tips. Having been an academic supervisor in this program, start early. Identify your supervisors early, both the academic one and the partner. Read the application form carefully, because this is not your average fellowship application, and also the peer review criteria and the distribution, and I'll show you this in just a second, of where the points will go to. Thirdly, get the right team. In order for this to be successful, you need the right partner to do this research, and you're going to be working really closely with them, and also your faculty advisor and your health system advisor probably need to have a good relationship as well in order to make your fellowship successful. And think hard about what is it you can achieve through the Health System Impact Fellowship that you couldn't do in a traditional postdoc or a PhD program. And think about that niche that you can fill with this opportunity. Next, please. So I just highlight this very briefly for the peer review criteria. It's all the details are in the application, but read them carefully. 35% of the score goes to your host partner organization and training, supervision, and mentorship. Thus, you need to find the really good partners. There are other aspects, obviously. Feasibility and impact are an important aspect of this as well. Next slide, please. I will also remind you, so the deadline is February 18th, but Cassandra kindly put this through this slide together for us. There are multiple steps, and there's a new process now for getting signatures. So yes, you need your RFAA, which you always need. You need your signatures, but you also need to go through the new system. And the reality is, in order to get all these signatures, and we'll share the slides after so you can read the fine print here, you will probably need to have at least 4 business days, even if we have fast turnaround. So I would say err on the side of caution and have your application ready a week before it's due, because it has to work through all of these steps in order to get signed. Now, I'm being a little bit cautious, but you do need to allow time for all the signatures. And they're really good. Our team at U of C is very responsive, but make sure they have time to respond. Thank you. Next. I'm also going to say and highlight for you, we're really excited that the O'Brien Institute has kindly offered this first time ever, a peer review opportunity for Health System Impact Fellows. So they will manage this just like we do for the internal peer review process for CIHR grants for investigators. These are the timelines. Again, we'll circulate the slide or go to the O'Brien Institute website. But by January 4th, you will need to register and use the long form, all on the website. And then you can see the deadlines here in terms of obtaining reviewers and getting input. I highly recommend the internal peer review process. You will get good feedback to try to polish that application to make it successful. So with that, I'll hand over to the next speaker, Tracy Waslick, and thank you very much. I hope those are useful tips. And I look.
Thank you very much, Dr. Marshall. Our next speaker is going to be Tracy Waslick, and she is the Chief Program Officer in Strategic Clinical Networks at Alberta Health Services. And she's going to focus on the SCN requests and partner organizations, as well as the health system supervisor perspective. Thank you, Tracy.
Thanks, everybody. And Deb, thanks so much for highlighting the key elements there. I just want to make one other point that people may not be aware of. Typically, an applicant has to be within 5 years of graduation from a PhD in order to qualify. However, because the fellowship, we lost the fellowship last year due to COVID, this is the only year where if you're 6 years out of a fellowship, 6 years out from your PhD, for the postdoc positions, you are eligible to apply. So Deb talked about the health system. Can you guys hear me okay? I'm just gonna put my video off because I don't wanna lose my sound. Deb talked a little bit about the fact that you need to find a health system fellow supervisor early in this process. And the good news for you, again, with the SCNs, the strategic clinical networks have not only set aside funding, but they have also tried to make sure that health system supervisor is available to you should you be interested in the opportunities that the FCNs afford. And I have a list for you, and we can share these slides with all of you, so you don't have to race to write it all down. You can read the content after. But we do have, we're interested from a provincial addictions and mental health. We have some work going on in a novel platform and looking at youth mental health using methodologies. And we think there's a great research opportunity for a fellow in that space. Critical care is looking for a fellow. They have a rich database, eCritical, that they are looking at mining that database to identify variations within the health system in practice and looking at targeting further evaluation and research to address those health system improvements. The Emerge department, Emerge SCN they have funding for 2 fellows. One is really focused around quantitative research, and the other is looking at health system clinical epidemiology and analytics. Next slide. Now, while the slide is turning over, the kidney health. So this year we amalgamated kidney and respiratory under the medicine SCN, but the kidney health section of medicine SCN is interested in pursuing some work related to acute kidney injury. And the fellow will leverage existing provincial healthcare data to assess the performance and to perform comprehensive analytics of the burden of AKI within their population, work with operations, and look at improving clinical practice. The medicine SCN wants to do something very similar, but their focus areas really are around, they're more interested in medicine in acute care and more from a hospital organization and operations. And then neurosciences, rehab, and vision is really interested in sorry, I just got to get this out of the way. They're really interested in looking at an they have an interdisciplinary team of healthcare professionals, researchers, and educators, and they would really like to look at 3 clinical streams. One is either neurosciences, second is rehabilitation, and the third is vision. So depending on the applicant, they could choose one of those areas. Next slide. And then finally, our last 3 are primary healthcare integration network is looking at integration across the health system and supporting the testing, implementation, scale, and spread of high value research and innovations in the primary care space. Surgery is looking at tapping into the data repositories for surgery, and Alberta has an initiative called the Alberta Surgical Initiative, and we're trying to address wait times. So this fellow's work would be focused around the work we're doing around central triage and access, and choosing a topic area within that strategy to support a better understanding about how do we reduce wait times across the province. And then finally, for the Alberta pain strategy, we're looking at a hub and spoke model for chronic pain. And so we're interested in a body of work that will look at this both from a health economics perspective and from a health system redesign perspective. Next slide. So the things that you have to consider. So from a health system supervisor perspective, one of the reasons that CIHR put together this program of work, as Deb indicated, was a modernization of training. And there's areas in the training that the health system and partner organizations can provide PhDs and postdocs that give them other competencies that may not have been a focus while you were doing your PhD. And so the host organizations are interested in those competencies because they constitute opportunities to advance your change management skills, understand the complexity of the health system and the partnerships, look at ways to be involved in implementation science projects that advance that whole KT side of the knowledge to action cycle. And several other competencies that are listed actually in one of the slides that's not in this deck, but is in the decks that Deborah referenced. And so part of choosing a health system supervisor is thinking about which core competencies you want to focus on to advance your skill set, and then matching those competencies to the project that you and a health system supervisor would agree to. So you can see from my descriptions there's huge opportunity to work within our large provincial health system in targeted areas that are obviously clinically focused, but also from a business, change management, knowledge translation, implementation science, data and analytics. There's quite a broad opportunity here. And, you know, we are excited. Alberta Health Services has had many health system fellows. You're going to hear from one of them for sure, and a couple of them. Alberta itself has done very well in this partnership, primarily because of the strength of the partnerships that we have with universities, the caliber of academic supervisors in this province, and I might say the fact that we are a single health system, making it easier for our fellows to really demonstrate impact over the course of the 2 years. So I'm going to stop there. I think if you can, I think next slide. Yeah, I'm going to stop there. I'm sure there's questions that you have, but hopefully that gives you a little bit of a perspective from the health system supervision perspective, and I'll turn it over to Alina.
Thank you very much, Tracy. That was great. The next panelists that are going to join us are Alina Loptina and Kieran Manas. And Alina is a PhD candidate in health economics in the Department of Community Health Science. And Kieran is a postdoctoral scholar. And they're going to talk about their experiences as a PhD and a postdoc fellow in the Health System Impact Fellowship, and focus on lessons learned about preparing to apply for this fellowship and the application. So thank you very much, Alina and Kieran, for joining us this afternoon.
Thank you, Dr. Beatty. I will start with a little bit of background. I was a Health System Impact PhD fellow in the inaugural PhD cohort in 2018-2019. And my partner organization was the Arthritis Alliance of Canada, which is a non-for-profit research organization supporting research on arthritis and improving lives for people with arthritis. And my health system supervisor was actually located at U of C. It was Diane Mosier, and my academic supervisor was Dr. Deborah Marshall. And the project I worked with the organization was focused on building an economic business case for models of care for patients with arthritis across Canada.
And hi, everybody. My name is Kieran Manhez. And so currently I'm the Assistant Scientific Director for one of Tracy's strategic clinical networks, particularly the Neurosciences Rehabilitation and Vision, SCN. But I'm here in my capacity as an alumni of the HSIF Fellowship Program. I was a postdoctoral fellow in the first cohort from 2017 to 2019. And I have the distinct honor and privilege of having Tracy as my health system supervisor. And I had two academic supervisors at the University of Alberta, Dr. Sunita Vora and Karin Olsen. And the focus of our project was looking at the implementation and evaluation of a provincial model of care focused on community rehabilitation. And so we did a large mixed method study using focus groups, interviews, and surveys. And so Alina and I are going to tag team this presentation a little bit and share a bit of our perspectives and our learning. Some are things that we definitely did, and some are things looking back and thinking we should have done this, or hearing from other people's experiences that's probably something to think about. And it was more serendipitous for us that it happened that way. And so our first recommendation, and it's kind of touched on, Deborah and Tracy mentioned as well, well is kind of knowing your why. So why do you want to do this specific fellowship? What are you going to get out? What are you looking to get out of it? What are the skills you want to develop? So I can share my why. So from a professional perspective, I've always looked to bridge my very diverse background disciplines. So I have a background in law and research. So I'm always interested in bridging policy analysis with empirical research, especially around stakeholder engagement, and using that towards health system innovation and health system change. I've also looked as we go through training as masters and PhDs, everything has a very time-limited scope. And so I wanted in my career that everything, when it ended, the next thing that started would be a move up. So that was professionally what I'm always looking for. And then personally, I did a postdoctoral fellowship before I did this health system impact fellowship, and it was amazing. It was with Dr. Suzanne Teff, but it was highly interrupted. So I had 3 maternity leaves in there. And so when I came back for my last year, I felt like I had lost a bit of momentum, and I wasn't sure what to do. And Jillian Curry, who works with Deborah Marshall, suggested this fellowship. And I said, no, I don't want to just keep doing fellowships. And she said, no, this is different. And she was definitely right. As soon as I saw it, I said, oh, this is exactly what I need. It's moving up, it's opening doors, it's giving me exposure to the inner workings of the health system, and it gives an opportunity to build my network and my skill set. So that was kind of my why. I'll pass it to Alina.
Thanks, Joanne. Well, my why was basically my focus and interest in getting some hands-on experience in research besides my PhD project, and also in doing an applied research work that can have some impact and help the healthcare system. So I actually continued working as a research associate when I started my PhD. Then I had a MyTax fellowship with Alberta Bone and Joint Institute. And when I heard that the Health System Impact Fellowship was announced, the first year, I thought that it was a great idea and a great opportunity for trainees, but it was only open for postdoctoral fellows. So the second year, when they actually started a PhD fellowship, I decided to apply because I was very keen in getting that hands-on embedded experience, and also the networking opportunities that the fellowship has been offering. And actually, going to the next point of finding the team, I was actually considering doing the project with my partner organization already when the fellowship was announced. My supervisor connected me with the partner organization because their research focus and their goals and aims were very much aligned with my research and my PhD research. So we were considering a project, and then the Health System Impact Fellowship for PhD trainees was announced. And I thought that it was a great opportunity to build on the work that I was already planning to do and add the other opportunities that the fellowship was providing in terms of professional development, networking, and all other opportunities. And I thought that's a great opportunity to actually apply and get all the benefits at once. Kieran?
Yeah, so for me, I had a different experience in finding the team. I used that partner linkage tool online, and when I looked, Alberta is first, Alberta Health Services is first, so it was the first one. I did look through the whole list, but that project resonated for me because it was Alberta focused. It's with the health system that I was interested in, and importantly, the focus that they were interested in was shared decision making, and the work that I had done before looked at consent and informed decision making. So it felt like a natural fit in that sense. And that kind of brings us to our third point, which is making the right match. So you kind of have to find the team. But Alina and I thought about, the important trifecta. So there's you, there are the supervisors, and there's that organizational context where you're working. And we'd recommend making sure there's a good match there, and thinking about, the skills of each kind of partner in this endeavor, thinking about personality and match, thinking about location, as well as expectations and goals. And I can speak to a bit about my experience here. So location, I was very, you want to think about what you can handle travel-wise. I know with COVID, everything is going virtual, so maybe this advice is not as relevant, or hopefully it will be relevant because we'll be able to go around a bit more again. But when I looked at it, I was very tied to Alberta, and I wanted to build my network in Alberta. So that's the other recommendation I would say around location, is think about where do you want to build your network. There's no guarantee that you will get a job with the team that you work as a fellow with, but you will definitely build your network and your connections and build relationships, and off of one of those branches will be your next opportunity. So thinking about where you want the root of that tree to be. Expectations are really important too. So Tracy and I, we didn't talk about it before, but we talked about it after we were successful, and it was wonderful to see that we had the same vision in mind. So Tracy had said, you know, I want to supervise this fellowship to show the organization, a learning or health organization, the value of having embedded researchers. And I, you know, for me, I wanted to show this organization the value of having me as one of those embedded researchers for my selfish long-term career goals, but hopefully would help other people as well too. So we wanted to make sure those are aligned. Elena, did you want to go?
Yes, so I just want to add a little bit to the location. My partner organization was located in Ontario, and I was actually part of the Central Region competition. But I did work remotely and just traveled for major meetings. And so I was, back in 2018, I was one of those who was working virtually, and I'm sure that might be even more feasible right now. But generally, making the right match wasn't really what I was thinking about when I applied for the fellowship, but it's certainly something that helped me and my fellowship to be a very good and useful experience for myself. During the fellowship, my cohort was very well connected and with each other, and we also did a little project to assess our experiences and to explore how those experiences of PhD fellows were different from postdoc fellows. And what we found was that one of the struggles that PhD fellows had is dealing with competing opportunities and also obligations, because there is a lot of training opportunities, networking opportunities through the fellowship, which are absolutely great and amazing, and everyone should take advantage of it. But while working on your PhD as well, sometimes it's really hard to manage those expectations and opportunities. And some people whose academic supervisors were not very much engaged into their fellowship projects, they reported having some troubles and challenges with balancing the expectations of the academic side and the health system side. So that's why I think making the right match is a very, very important piece here to make sure that you actually get all the benefits of this fellowship and that you actually have a good experience. And having said that, I also want to mention that the program itself has been very helpful and supportive of fellows, and they have been developing over years a lot of supporting materials for both fellows and the supervisors to help them manage those kind of relationships, because it's a new program and they're learning as well. And going to the next point of crafting your project, I actually think now, looking back at my own experience, I think the time when you're working on the project, when you're discussing it with your partner organization, is a great time to make sure that the right fit is there. And that's why one of the first suggestions that we thought with Kieran about was start early. And that will give you time to actually talk to your partner organization, talk to your health system supervisor, talk to your academic supervisor, and make sure that the right match is there, and make sure that that your expectations are actually aligned with each other, and that everyone has the clear vision of the fellowship and your goals and objectives. Another recommendation is to co-create your project with your partner organization. That would help, again, to establish that common understanding of what everyone is doing in the fellowship and what are your goals. But also it will be helpful to show how the project and how your partner organization are aligned with your personal goals, because the strength of the partner organization and the strength of connection between your career goals and your project and the partner organization is one of the key criteria for evaluating the application. So that link should be very clear, and that's probably something that would be definitely helpful to discuss with your supervisors and your health system. And also, while you're working on the project, I think it's very important to think about the scope. For PhD fellows specifically, I would suggest being mindful of the timelines, because this is a one-year fellowship. A lot is going on. So the project should be feasible. It should be also meaningful, and it should be meeting your goals, but it should be feasible in timelines. So one of the comments and critique that I got on my application from reviewers was the scope of the project that was too large. And while I started working on the project even before my fellowship started, I already had my ethics approval in place. Still, I have to admit that the reviewers were right, and I'm still working on some of the pieces of that research a year and a half after I finished my fellowship. So that's definitely something to consider in terms of your timelines. And also for PhD fellows specifically, I would suggest thinking about whether your fellowship project is embedded into your PhD thesis. My project was not, because I didn't know that it's actually possible, but I know that many people have done it. And there are pros and cons for both ways of doing it. If your project is separate from your PhD, you probably would get more, you can probably get a variety of different skills that you probably won't get into in your PhD, but it will potentially delay your PhD. And from my discussions with fellows, they think that it delayed their work from 6 months to 12 months approximately. On the other hand, if your fellowship project is linked to your thesis, that might be helpful in terms of time saving. But I've heard about some fellows who've struggled with their partnership organization changing their focus, and then the fellows not being able to collect data for their thesis during the fellowship. So that's just the minor things to consider while you're working on the project, and that's why I think everyone should be very clear about their expectations and what they want to get out of the fellowship. And I will pass to Kieran.
Yeah, no, I can just speak to a bit of the postdoctoral fellow project. I believe it has to be something that you're not working on right now. So it can't be, you know, when you apply for the other postdocs from CIHR, it can be you've started it and you need funding to finish. This has to be a new project. And like Tracy had said, we're looking, I believe they look for, CIHR looks for successful applicants where they are planning something that's impactful, and it's that right balance of ambitious and feasible. So this is a 2-year project. You can do something pretty substantial, but you still have to be feasible. And as you all know from grant writing as well, be really specific and clear, especially in that proposal of what exactly you're going to do. I'd also recommend that clarity in your letters of support. So helping your supervisors to write those letters according to the CIHR guidelines, so they can really see that, you know, this supervisor is going to give XYZ as support to the fellow, and that goes to that 35% of the review. So really spending as much time on those letters of support and the framework of where you're going to be working to demonstrate, and that comes with the collaboration and co-creation of the project as well. And like Deborah said, know your RSO deadlines and go from there. And I guess the last point I'll make before we open up to questions is just, I mean, there's 66, so I think there was 35 fellows when I started, so it's definitely double. There's definitely lots, but there is kind of the regional limits, like so much money goes to Central Canada, so much money goes to Western Canada. So, you know, we might not all get one, but I think if you see a project that's of interest or an SCN, or, you know, you see those of interest, it shows an organization that's interested in your type of skill set. So having the conversation and meeting people and developing the grant, even if you're not successful, could possibly lead to something else. Like Tracy said, like there's a lot of work at the SCNs. We need a lot of smart people and help. So, you know, if we don't get this opportunity, there might be something else. So there's never a wasted application. I will end with that.
Hey, thank you, Elena and Kieran, for those great perspectives from the student and postdoc point of view. So I guess we'll turn it to some questions and answers. Elizabeth, can you just maybe stop sharing your screen for the Q&A session? I just want to draw your attention to some questions that have been asked and answered in the chat already. With respect to the internal peer review process that's going to be undertaken for these fellowships, it's going to be combined with community health science and the Cummings School of Medicine, and looking at what resources we already have in place to help support you. And one of the questions was if there was quote unquote templates available already. And one of the things that Deb Marshall had suggested was perhaps finding some successful applications, and maybe the 2 fellows that are on the call might be willing to share their successful applications. I found with a number of other studentships that that's one of the best resources to to help students and postdocs formulate their own application is looking at what has been successful in the past. The other question was whether or not someone who had an HSIF support during their PhD can also receive support while they're a postdoc, and the answer seems to be yes. And I know, Kieran, you had mentioned that these were for new projects, not just existing projects. But one question that came from one of the attendees was, do you need to choose from one of the listed projects? I don't have an answer to that. Can I throw it out to one of the panelists to address that question, please?
Sorry, you broke up on me, Tara.
Yeah, whether or not there's the question about whether or not the postdocs can propose, or the fellows can propose a new project, or do they need to choose from one of the projects that is listed?
Okay, well, let me take that one first, Kieran and Alina, if you want, and then Deb. The general answer is that depends. You can tell by the slides that we were pretty broad in our application, because we wanted to then draw people into the areas of relevance and then do a deep dive, as Kieran said, and get very focused on a very specific opportunity. For a PhD student, that's really important, because as Alina said, you want to get something really tight and narrow and line it up. For the postdocs, you can't just do, you know, old work, but in my case with Kieran, we wanted to build on her assets and her background. And so we were able to, through a series of discussions with the supervisors, find that niche. So the long answer is, yes, go ahead and pitch an idea. Contact on the web, the SCNs of relevance, the contact people are there. I'd be reaching out to them to say, here's what I'm thinking, and see if it's a fit or not. Hopefully that answers your question. And Deb, Alina, or Kieran, I don't know if you had anything further to say.
Yes, thank you, Tracy. I just want to add, yes, definitely people can propose their projects. And also, I think the tool, Lincoln tool, is absolutely amazing, especially if you don't have ideas about the organizations that can potentially be your partners. But I would also suggest not limiting yourself to the organizations that are listed there, and think about it broadly. If you know about the organization that could potentially work as your partner organization and they never did that before, maybe that's something that you can explore and just pitch your idea to them and try to find a supervisor there. And I know many people who've done it before, like my organization has never been a supervisor before or a hosting organization, and it's just a matter of working it out. And that's why it's so important to start early talking about it.
Okay.
I would just add, yeah, like Tracy and Alina put everything perfectly. I would say when I applied for my fellowship, yeah, we did craft it from that initial topic, and I thought I was, you know, the only HS fellow. And then when we got it, I think there were 6 of us in the province. So, you know, the tool is definitely a very useful tool, but it's not the only way to find your opportunity and create something that you'll want to work on for a year or two.
Deb, did you have something to add to that?
Yeah, I just wanted to say that I think it really depends on your interest. I think you probably have a strategic advantage, if I could say, if your interests fit within the identified areas from HS as a partner or other organizations who have listings on the Health System Impact Fellowship site, just by virtue of the fact that they're saying, I want to do this too. So you're kind of already a good way along the way of identifying a good partnership, because they're keen, they're interested, they have a topic. So if it fits your interest, it seems to me that that probably is a good thing, and probably increases your probability of having a partner who is willing to commit the time, willing to commit the budget, because they already know what the rules are, and is probably going to be easier to create a successful application with. But if those topics don't fit, I wouldn't restrain yourself either. Just make sure you get someone who understands the rules and is clear about how this works if they don't have that experience.
Okay, thank you. The next question in the chat is from someone who was preparing an HSIF application and then transitioned the project for the 2020 CIHR fellowship competition, and now was wondering if they would be eligible to also now apply for HSIF. And looking at some of the responses in the chat, I'm just going to summarize and then have the panelists address this, is that you can apply to both. However, they cannot be an identical project. And still for the HSIF, you need to have a health system partner. I don't know, Faye, if that answers your question, or any of the panelists would like to elaborate on what I've said.
I think that's smart, to apply for as many things as you can.
Okay.
Tara, I just wanted
Sorry.
to make one other point that I think is important. So when you get into the guidelines, 70% of your time has to be devoted to that project that has been identified by your academic and health system supervisors. You have leeway to do work in 30% that is more customized to your areas of interest. So I don't want to lose that, because Kieran, maybe you can talk about the pediatric work you did, because that was a particular policy interest of yours. That 70% was doing one thing, but we did carve out time for you to do something specific to meet your needs.
Yeah, no, and I mean, I think the big project should definitely meet your needs, but there is, speaking with your supervisors ahead of time, we kind of talk about it after, and having a clear definition of what the academic project is, and you know, who decides what you're working on. And so my work before had been in pediatrics, and we're looking at, the big project was looking at shared decision making within the context of community rehab, and we decided to do a systematic review looking at shared decision making within the pediatric space, so that it connected, so it wasn't totally different work but built on each other, and that was an opportunity to do some integrated knowledge translation and connect with other people. So yeah, and there was several other projects that I was able to work on with Tracy. I know she did really protect my time, and I think finding a supervisor that protects your time so you work on this so you don't get pulled into a million different directions is really important. But she did offer, you know, we did work on some other opportunities. We worked with a community organization, Action Dignity, to look at health literacy and a new online information resource tool. So there's you know, there's that project is like your center access, but there can be other things as well too, and it's just, again, finding that right team and the opportunities that they can present.
Okay, thank you. One of the questions is there a list of postdocs who have undertaken this fellowship that we could reach out to or be paired with to support our application? The answer is that there is a list on the website. It's a place to start. And I think part of the internal peer review program will be, and please correct me if I'm wrong, but to try to identify mentors within the Cummings School of Medicine or the OIPH that could help you developing based on their skills and expertise.
Yeah, so a couple different things on the O'Brien Institute IPR process. So the idea will be to, just like we do with a grant, if you're an investigator, would be to submit a version of your proposal and essentially have it critically assessed with constructive commentary about how it could be improved in order to try to increase the success rate. As you know, the IPR process at O'Brien has been really successful in improving our success rates in CIHR and other kinds of grant competitions. So that was the thinking behind this. And then I just say that both Tracy and Tracy as the health system partner and myself as a faculty advisor have agreed to essentially be a point of contact to try to help people respond, give them some, you know, advice. We will not, for obvious reasons, be reviewers of your actual proposal though, because that would be a conflict of interest for us because we have our own students and trainees going in. So we don't want to interject any bias there in evaluating the applications. So two different roles. It's kind of the support in general and the contact and help in answering questions or guiding you about the process. And then there will be a peer review process with members of the O'Brien Institute providing that review. Does that make sense?
Thank
And
you.
I just wanted to add, sorry, that Rosman, if you see, or anyone who's applying, if you, I personally found that Health System Impactfiles is a very, very open group of people, and very helpful and willing to work and willing to collaborate and willing to help anyone who wants to get in the program, because most of us are very passionate about the program and very much want to help other people to succeed in it. So if you see someone who's listed on that website and you're interested in and you think that there's some alignment and they can help you, maybe just reach out. And I know that some people have their emails listed there, and I'm pretty sure that many people there would be willing to help.
There was a question from Sheila McDonald, who has indicated that she's part of an organization but does not necessarily have any budgetary control, and how they could possibly, how this organization can possibly support. And the answer was to connect and partner with one of the SCNs and possibly providing guidance without the fiscal responsibility. Does that answer your question, Sheila? All good?
Yeah, all good.
Okay, thank you. As graduating PhD trainees, is the application process for a postdoctoral fellowship the same as a current postdoc? That came from George. I'm not sure exactly what your question is, George.
I can clarify. I think in order
Okay.
to be successful, as if you're applying for the postdoc, you have to have completed all of your PhD work, by September of 2021. So if you haven't passed all your requirements, then you aren't eligible for a 2-year. You would still be seen as a PhD. But if you are, let's say you graduate August 31st, you're eligible because the funding flows September 1.
Yeah,
Thank
and
you.
the only thing that I might add to that, and perhaps Tara would like to comment on that too, is you would need to be really sure that you'll be done by then, because as you know, sometimes it takes a while if there are revisions, or it takes sometimes a time to schedule a defense, and B, depending on how everything goes, you have to allow time to complete any revisions if they're necessary. So I would just be cautious about planning that timeline in terms of actually having graduated, because you will have had to submit and be approved and recommended and etc. for graduation before that time. So
Yes, and it always takes a little bit longer than everybody anticipates.
funny how that is. Yes.
Any other questions for any of our panelists? Okay, well, seeing none, I just really want to take this opportunity to thank Deborah, Tracy, Elena, Kieran, and Elizabeth for organizing and really bringing everybody together for this. Really great to see so many people interested in this opportunity. Just to remind you, the application date is February 18th, and try to have, a week before everything in for signatures. I do my best to turn around as quickly as I can, but I'm not always sitting at my desk just waiting to sign things. So a little bit of heads up is always better. Will the slides be made available? Yes, we will make the slides available. So yeah, the application deadline is February the 18th. Notice of decision will come out June 15th with a funding start date of September 21st. And please, if you have any questions, contact Dr. Marshall or Dr. Adoni Palucci. And yeah. Oh, current postdoc. Sorry, I've just seen a bunch of stuff on the chat. Just want to make sure that we're not missing anything. Oh, and thank you to Angela for her technical help in getting all of this organized. My apologies, Angela, trying to navigate too many things online. So really big thanks to Angela and the IPH@ucalgary.ca for any follow-up questions regarding this process.
Yes, and could I also just ask Angela and Brittany, when we say we'll post the slides online, you'll put them on the O'Brien Institute website under some tab or on Health System Impact Fellowship, or where will people find them?
Yes, what we can do is put them on our site under the event. If you go to our events calendar on this date, and then we'll also find another appropriate space for them to live. But in the meantime, we'll post the recording and the slides this afternoon on our events calendar on this date, so people can find them quite easily.
Thank you.
Okay.
Thank you. Extra thanks to Elena and Kieran for squeezing into their day on super short notice and sharing their experiences.
Thanks very much. The other thing, you guys, I wonder if we can post the original slides from CIHR. Deb, I think we could do both. Our presentation, it's a little truncated, but then those detailed slides.
Yeah, thanks for the clarification. That's what I was thinking too, because the lovely details are in the CIHR slides. So I think you'll find that very helpful if you don't have that already.
Thanks all. Great. Hope it helps. Have a great day.
Good luck, everyone.
Thank you.